Good afternoon to all the Daily Voice viewers and viewers of its sister publications. My name is Dr.Rapiti, and today I will be talking to you about a topic that's been hotly debated over this lockdown period, and that is smoking. A little bit about myself. I've been a general practitioner, family physician for the last 37 years. In addition to all the other services I offer, I have a very special interest in the field of addiction. And I have written a book, 4 Steps to Healing. It is this book here. This book has been being published about 10 years ago. The purpose of this book has been to help people with addiction and their families to cope with addiction. I will be talking to you about smoking in the following manner. We'll be looking at the effects of smoking on the body, number 1. Number 2, how does smoking one become so addicted to smoking? And 3, why do I feel cigarettes is the most addicting substance compared to all the hardcore drugs? Fourthly, we'll be looking at the economic aspects of smoking, both the direct and indirect costs of smoking. Fifthly, we'll be looking at the lockdown and why I am opposed to the lockdown. And lastly, I'm going to show you how to quit. I have a very successful, easy, simple program. With the limited time we have, let's dive right into our topic, and we're going to talk to you about the effects on the body. In a simple line, smoking affects the whole body from head to toe. If we start from the head, in the brain, it can affect the vessels in the brain, can damage brain cells, and that can lead to dementia, strokes, and delirium as well when they get into other problems. Then in the lungs, it can give rise to a condition called a COPD and emphysema, which I'll be talking to you about at length later in the discussion. Then it can lead to heart failure, and then it can affect people who are smokers to become pretty refractory in their condition. Then it also can affect couples that are struggling to fall pregnant, have children, because what happens is the smoking causes azoospermia in the man when he smokes. And then the other thing about cigarette smoking, it is believed that 40 to 50% of people who smoke could end up with diabetes. And if they end up with diabetes and they have obstructive airways disease, they've got a double attack on their body. On the one hand, the lungs are being destroyed. On the other hand, the diabetes is affecting every cell in their vessel in their body. Coming to the years, about 70% of smokers might lose their hearing by the age of 60, 70. And in the eyes, it can affect the retina, the macula, and those are important for vision, and people could end up with diminished vision, and end up with cataracts. And I mentioned heart attacks and stroke. Then there is the issue about sleep deprivation. I need to mention a little bit about sleep deprivation. We're going to understand that people smoke for the nicotine effect. The nicotine stops the withdrawals. And the nicotine only lasts for about 4 hours. So if you take your smoke at about 10 o'clock in the evening, at around about 2 o'clock, the nicotine withdraws, and then you start getting the withdrawal effects, and that is when you start getting, your heart starts beating fast, palpitations, you get sweaty, you wake up, your sleep is around, it's broken. So you struggle to fall off to sleep. So in effect, you've not even had really 4 hours of sleep. By the end of the day, when you wake up in the morning, you're feeling extremely tired. Yes, you reach for that cigarette. But at work, you're irritable, you're moody, not just for the cigarette, because you've been sleep deprived. Imagine you going through life for the next 40 or 50 years of your smoking and sleeping with just having 4 hours of probably good quality sleep. It's terribly insufficient, and I might add that poor quality of sleep is a big cause, a contributor to heart attacks and sleep apnea. Now, how does one become? I'm going to now take you to the 2 major diseases that are caused by smoking, and that is chronic obstructive airways disease and emphysema. I'll give you a picture of the lung, the inside of the lung. In fact, this is a whole picture of the lung. This is what you're seeing, what we're going to be talking about. This is the entire lung here. This is the bronchi. These are the pipes that take the air in. And these are your air sacs. This is where the air exchange takes place. And these are the blood vessels. We're going to focus on those three aspects. I'm now going to show you graphically what is going to happen. Now, with emphysema, with obstructive airways disease, this is what's going to happen to you. This is your lungs, we talked to you about earlier. This is the size of a normal airway, normal one. With progressive smoking for a period of about 30 years, you can see this airway is narrowing down. What is actually happening? This is your airway. What the smoking does with repeated attack on the blood cells, the lining of the airways, is damaging the elasticity of the airways. And this is a dangerous situation, because what happens if the elasticity is damaged? Remember, the airways are kept open and patent by the elastic tissue. When that is damaged, it gets progressively narrow. Unlike with an asthmatic, the airways gets narrowed to muscles being tightened, and we can relieve that with a pump. I'm sorry, when you've got obstructive airways disease, the elastic tissue is damaged. It gets progressively narrower and narrower. By the time you've smoked for about 30 years, you've lost almost 80 to 90% of your lung function. And how do we test whether you've got COPD? Here's an instrument, very simple to use. It's called a peak flow meter. And all that one needs is to blow like this. And this should give you a reading of 400. With a smoker who should be smoking blowing 500, it will be down to 20%. And the strange thing is that even though he's down to 20%, he would be unaware of it. But what he would find at around about age 50, he's unable to walk. He gets very, very tired. He has constant coughing. So that's the one aspect that's called chronic obstructive airways disease. We mentioned the next part that gets damaged is these alveoli. Remember the air sacs that we were talking about? These air sacs here. The function of these air sacs is where the air gets in and oxygen is transported into the blood system and carbon dioxide is released. When this gets damaged, no exchange takes place, and I'll show it to you in this little picture here. This is your airways, normal airways. With progressive smoking, it just gets an empty bag with no air. So what happens is your body retains the carbon dioxide and it doesn't get enough oxygen. You get extremely tired and you cannot function. So we call these people blue bloaters. Now I told you about two conditions. Remember? Emphysema is one and chronic obstructive airways. These two combined together give you a condition called pulmonale. What that simply refers to is right heart failure. Let me explain to you on this diagram. When you end up with emphysema and obstructive airways disease, what normally happens is, this is your heart. This is the normal shape of your heart. You find that blood is being pushed into the lungs for the lungs to be oxygenated. But when you get emphysema, the pressure in the blood vessels of the lungs, these lines here we talk about, when that increases, it tends to push this blood back. When it pushes it back, you can see now what's happening to your heart. It's getting bigger in size. We call this right heart failure. And when you get right heart failure, the blood that comes in can no longer come in. It starts collecting in your body. This is your body. The red is your original shape when you were a young man, when life never mattered to you. You were daring as a devil. You smoked 20 and you couldn't give a damn. Well, now you're 50. You've got now pulmonale. Here's your stomach looking fat as anything else. It's filled with fluid. Your legs are swollen. You are bedridden. You can barely breathe. You can barely dress yourself. You can barely go for a walk. And now you're suffering with this severe condition. So these are the three main severe conditions: obstructive airways disease, emphysema, and right heart failure. I just want to explain a little bit to you about why smokers cough so much. Here is the lining of your airways. It's lined with this type of cell. It's called the columnar cell. The purpose of this cell is to produce mucus to keep it moist, and then you've got little airway, little cilia airs. What this little cilia do, it pushes the mucus away. With smokers, this gets damaged and it gets flattened out, and so you can no longer get rid of that mucus. So what happens? You constantly cough. What smokers call the smoker's cough. Within about 30 years, this cell will get completely damaged and replaced by the squamous cell, and this is the dangerous cell. This is the cell that leads to cancer of the lungs. And ladies and gentlemen, when you get cancer of the lungs, it is often picked up very late. There's very little we can do for you. In fact, many people end up dying because it's just too late. We don't pick it up. Now we're going to move on to the next part of our discussion, and that's how does one become addicted to cigarettes. It's one simple thing. It's nicotine. Nicotine is a highly addicting substance. What exactly happens? Nicotine does not make you feel good. Don't for one moment think that nicotine is the driving force to make you feel nice, make you feel relaxed. I'll explain to you why you feel relaxed with smoking. What exactly happens is the nicotine, when you take your first smoke, you don't feel great. If you're a youngster, you feel wonderful, you look very big. The nicotine settles in your brain. The problem arises when the nicotine withdraws within an hour or two. You get severe withdrawal effects. And let me explain to you what these withdrawal effects are. It is this withdrawal effects that makes you hooked. The withdrawal effects can be summarized by this acronym RIDS. RIDS stands for restlessness, I for irritability, D for feeling desperate, and S for sleeplessness. What you're actually experiencing, and those of you in this lockdown period who were denied access to your cigarette smoking, would have experienced, you have the symptoms that are similar to a panic attack or a generalized anxiety attack. And the symptoms of these two conditions are very similar. Palpitations, heart beating fast, tremors, getting sweaty, mouth getting dry. The only difference with smoking and panic attacks, you don't get frightened, you get agitated. You get worked up about everything. Your wife or your partner is not doing things right for you. The dog's making a noise. Everybody's upsetting. You become short-tempered. You snap at everyone and anyone unnecessarily. And the only thing that's going to stop this is to replace this nicotine. You must have heard of people say, if you've got a babalas in the morning, have another drink. All you're doing is that you're replacing what you've lost. So the same thing with the cigarette smoker. If you can wake up at 2 o'clock and you're getting restless, if you had a smoke, you'll go back to sleep. But that's not the ideal situation. So that is why people smoke so much. They get the withdrawal effects, and within an hour, you're getting your withdrawal effects, you're getting snappy, and the only thing that's going to help you is another cigarette. That is what explains why people become chain smokers. And if you go to any support groups, you'll hear the more you use, the more you lose. What does that mean? Initially, you would smoke 5 cigarettes, you'd manage. Then you progress to 10, 20, 30, 40, and 60. Because the nicotine just doesn't seem to last long enough in your body, and you have severe withdrawal effects. Those of you who have been on holiday or relaxing will notice on a Sunday you smoke more because you're bored and you become aware of the nicotine withdrawal. If you're actively working, you forget about it. And smokers would say, I feel good and relaxed, that is why I smoke. Not really. You're not feeling relaxed. You're actually feeling very agitated. Not because of your circumstances, not at all. You're feeling agitated because of the withdrawal effects. And yes, you will feel relaxed the minute you take the cigarette, the nicotine. So when you say you feel relaxed, yes, you will, because you've been agitated by the withdrawal. Relaxation really is about going to the beach, painting, listening to music. That's what you call relaxation. Now, we get to the next part. Why do I say cigarette smoke is, nicotine is so addicting and the most addicting. It only dawned on me on this lockdown period what you smokers have been going through. I'm not seeing behavior of tech users and heroin users as bad as smokers who were without their cigarettes. We never saw this before because cigarettes were so freely available. So you thought, well, cigarette smokers are not as bad as tech addicts. But I've been abused in the most vulgar manner for a very innocuous skirt. And I realized that these people were angry. And why do I say that nicotine is so addicting? Well, generally, smokers smoke till their death. Even patients on oxygen, with heart attacks, with strokes. You can have a stroke and you will still go on smoking, even despite your doctor telling you it was your smoking that caused your stroke. I'm not attacking smokers here. This is the power of addiction. And I feel, I empathize with you. And you should have been helped about that. The other part is, if you take asthmatics, these are people battling for air. They cannot breathe. I remember seeing an elderly gentleman on Table Mountain. You could see he was struggling to breathe. He had a cigarette in one hand. He took the cigarette out, took the ventilator pump, had 2 puffs and carried on. And I thought, what a irony. You're killing yourself on the one hand and you're trying to relieve yourself on the other. It just doesn't make sense. I've seen tech and heroin users who've quit their tech and heroin. And yes, we thought these were very potent addictions. They quit after 10 years, but they could never quit their smoking. And my thinking, why I feel they cannot quit smoking, is because it's legal, so they think it's socially acceptable, and it's freely available. What they don't realize is that they are actually addicted to the most addicting substance, and they cannot quit. Furthermore, you go to any rehab, you'll find drug counselors are smoking, and they smoke on the perception that it calms them. They too are addicted. I have held a strong belief, if you want to quit an addiction, you quit all types of addiction. Well, there's another thing I need to tell you, and that is smoking is a gateway drug to all other drugs. I worked in a youth centre for juvenile prisoners or waiting trial. Every one of them smoked, and they all said they started with smoking. Because after a while they get tempted to going into dacha and tikkum, whatever. I'm now going to move on to the next part of my talk, and that is, what role did the cigarette companies play to encourage smoking and make it so widespread? Well, back in the 20 years ago, this is what their strategy was. They went to colleges and they dished out free cigarettes. They started up cigarette parties. They made it all fun. But in the back of their mind, they knew once they got the nicotine into an individual's blood system in their brain, they've got an addict for life. They believe, give the first one for free and you got a client for life. And yes, folks, you're going to tell me about people who smoke to the age of 80, they've been addicted and propping up the industry of smoking, the smoking industry for a long time. And there's another point I need to mention, that adolescents who start smoking, there's a high risk of them remaining addicted for life. I need to mention to you about this thing about light cigarettes. This is another ploy by this cigarette company. It's total rubbish. Light cigarettes doesn't reduce anything. In fact, what is light cigarettes is half the nicotine. So if you smoke for only one reason, and that reason is to get the nicotine effect. So if you want to get it, you're going to smoke double the amount of a light cigarette to get the same nicotine as a strong cigarette. What in effect you're doing is you're smoking double the amount of smoke. It says the smoke with 4,000 chemicals plus the nicotine that's causing the damage. Frankly, the light cigarettes should be banned. They're useless. They serve no purpose. The next point I want to mention to you is the e-cigarettes. Everybody thinks, oh, it's the alternative, you know, it's free of the smoke. But you've got the nicotine. It's the nicotine that's making you addicted to it. So you will never give up that. And they are costly. And in them are 2 chemicals that are prone to causing cancer. One of them is called a popcorn lung, because they use a flavorant that's used for popcorn, the butter flavorant. and they found that workers were getting emphysema through that. So let's not forget that they are dangerous. And a study in America has shown that 50% of adolescents who took to smoking e-cigarettes changed to tobacco smoke because of price. So really, I don't see a place for e-cigarettes. Besides, I wouldn't like to be in the front of an e-smoker puffing my view with plumes of his ugly smoke. So he can keep it to himself. Now we go to another very important aspect of my talk, and that is the direct and indirect costs of smoking. If you're smoking 20 cigarettes a day for 30 years, you'll be spending 1,500 rands a month, 18,000 rands a year, almost 200k in 10 years, and in 30 years, with inflation included, it'll be 1 million. Well, this figure is even worse now. At the current rate, at 200 rands a day for a packet of cigarettes, which shows you how addicting smoking is, it's going to work out to 6,000 a month, 72,000 a year, and in 10 years, you'll have spent 4 million rands over 30 years. 4 million rands. Who can earn that? Who retires with that amount? It's ludicrous to say that I enjoy smoking and you're spending that amount of money. Well, by the time you reach age 50, you smoked for 30 years. You spend, and smokers, remember, in 4 15-minute smoke breaks at work, this is a loss to the economy. I've lost 200 hours a year. That's 26 days lost. You work out how much that's costing the economy. The damage to the environment and the more days of work, because smokers, by and large, probably go 4 to 5 times more often to healthcare or seek health advice. Now, at age 50, when you smoke for 30 years, this is what happens. Your lung function deteriorates to the point where you are on 20% lung functions. It is said that you look like somebody that is 70, but I can tell you, I cannot see any 50-year-old would compare with one of my 70-year-old patients who is a regular marathon runner. He does 22k. If you're a 50-year-old smoking for 30 years, I don't think you can run even after a kilometer or run around your grandchild if you want to enjoy your fun with your grandchild. The other dangerous, costly aspect, at the age of 50, when you're in the prime of your life, when your family needs you, you end up boarded through illness like emphysema, obstructive airways disease, and heart failure. God forbid you end up at the age of 40 dying of a severe heart attack, or ending up with cancer like one of my patients at the age of 30, picked up a breast lump. I didn't even think it was dangerous. Tested it, cancer was inoperable. Yes, it is, you render your family destitute, because when you retire or boarded at the age of 50, these are what are the indirect costs. Because when you render your family destitute, you are now seeking treatment for 20 years. Your family needs to rely on a grant from the government for the next 20 years. You might say as smokers, no, but you know, doctor, we pay taxes. Well, I'm going to tell you, your taxes on cigarettes is small change compared to the cost of keeping you alive and providing you with all the pumps. The pumps required are extremely expensive and they don't work. The best treatment for a smoker is to stop smoking. None of the medications we have. And if you want to reduce your incidence or risk of heart disease, if you cut your smoking out, you'll be as good as anybody else. You'll reduce it by 50%. So I think that's a good reason why you should stop. I'm now going to go into the very hot topic of the season, the month, and that is the lockdown and why I oppose its banning. I think firstly, it was the government really committed a major blunder. They did not look at this thing holistically. Firstly, I can list about 11. The first one is totally unconstitutional because we're not talking about smoking here. We're talking about an addiction. And you cannot outlaw somebody or make them a criminal because they have an addiction. Remember, the World Health Organization declared in 2011, addiction should be treated as a disease and should not be criminalized. They encouraged member states, including South Africa,
to set up rehabs, support groups. And I firmly believe after this lockdown, smokers who cannot quit their addiction should go and enter a rehab. And I'll promote that the establishment of rehab, specially dedicated for smokers, because I think a 3 to even 6 months program that will help to quit their habit will be a major, major cost saving. In that regard, I would think even the medical aid should support such a thing, because they're spending oodles of money trying to repair damage, really not doing much, but just prolonging life. Secondly, the government failed in its objective because 90% of the people smoked. So where was the point? Thirdly, the high price of the drug, of the cigarettes, 300 rands a pack, caused people to share their cigarettes. Because what actually happened, because you had a limited number of cigarettes, a family that smokes, or 5 guys, would pass the same cigarette around. So how good is that a saving in terms of keeping the curve flat? I think that's a little daft. In fact, it made the situation worse. Because the cigarettes cost about 300 rands or 200 rands, it caused immense hardship to families. Because the families had to make sacrifice on essentials like electricity, food, clothing, you name it, just to help the smoker to combat his withdrawal effects. I understand that, because to live with somebody that's got severe withdrawal effects is unbearable. Then we lost revenue. We lost 3 billion rand in taxes. I'm not promoting that we should get our taxes that way, but be that as it may, we will. And where did we lose it? We opened the doors to the illegal market, who were charging these enormous prices for a 10 rand packet of cheap cigarettes. They were selling it for 180, making a profit of 160 rand. And I think the government should have known that banning and prohibition are a waste of time. In America, they realized it. We don't do that. We've got easily available heroin, cocaine, dacha, cannabis. It's illegal, but you can get it from every street corner. What made them think in their little minds that if you ban cigarettes, it won't be available? It's available in every street. The other thing is, number 8, is that they force smokers to buy poorly manufactured drugs, drugs with bad components in it, bad chemicals. And my question is, should these people suffer severe adverse effects from the poisonous chemicals in it? Who would take responsibility for it? The 9th point is that I think the government was a bit myopic in introducing the law. Why introduce a law when you cannot implement it? We do not have enough police to police 11 million smokers. And I think that was an absolute waste of time. My 11th point is that the state has failed in helping smokers because they did not support them in any way to deal with their addiction. In fact, this I think is criminal. My next point is that I feel that the doctors who supported were short on the knowledge of addiction. I think they should have looked at it from a more holistic point of view and reviewed their whole decision. My last point is that I'm a little disappointed with addiction counsellors who should have known better and stood up for the smokers and done something about it. I feel government should assist smokers and to quit. They should do it as of now. They should offer free drugs like Zyban, which I'll be talking about, because it's cheaper to get people off their smoking than to treat them with a stroke, heart attack, and put them on social grants. It's not rocket science, it's easy peasy. Even medical aids should consider giving Nicorette chewing gums and stuff like that. Now we get to the last point. I just need to mention, when I say that I'm opposed to the banning of cigarettes, I do not wish to say that I support smoking. In no way do I do that. I feel sorry for the smokers. I empathize with them. I feel sorry because I understand addiction, not because I support smoking. How do you get rid of addiction? There's a medical way of doing it, and that is you're going to have chewing gums, have nicotine in it, you have patches, and you have sprays. They work, but they don't work very well. Because when if you don't realize that it's not only the nicotine that relaxes you, it's this habit, you know. You keep doing this, and then you forget about your manager or the customer that irritated you because you're doing this. If you didn't have even pull the smoke and you did that, you might just feel relaxed. Try it. The other drug that I would recommend is Zyban and Champix. It has worked. I don't think it's too expensive. I mean, Champix is about 400 rands. Think of it, that will last you a month and you spending 200 rands in a day. It's not rocket science, no. It's a good investment to get something to stop your smoking and stop moaning about the lockdown. Try and get some help. Then Zyban is not a bad drug. It's bupropion. It's an antidepressant. It seems to work quite well. I've used it and people have found it. But my preferred method is relaxation, breathing and meditation. I've spoken a lot. Now I'm going to demonstrate by a simple method. Now put down your coffee. If you're smoking, put it down, take a relax and watch me as I perform my relaxation technique. Now there you go. Put your hands together. Take a deep breath in. Up with your shoulders. Squeeze them tight. Smile. 1, 2, 3, 4 and slowly down. Again, deep breath in. Smile. 1, 2, 3, 4. Tight, 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 and slowly down. See how easy is that? Now I'm going to show you. This looks simple and stupid to you. Let me explain to you the scientific basis of using this method. When you get your withdrawal effects, your adrenaline is pumping, your sympathetic nerves is going at you like a tiger is behind you. You're agitated, your heart rate's beating faster, you're tremoring. But when you breathe, you pull your muscles tight and you smile. You stimulate your vagus nerve. Even if you do even that, you stimulate what the function of vagus nerve is. Slow your heart rate down, make you calm, make you relaxed. Now what's the purpose? When you smile, fake it to make it to break it. When you smile, the brain interprets it as you're happy and then it calms your body down and sends the positive hormones. Do you think my method works? Yes, it does. I'm going to quote 3 examples. I had a 55-year-old female, smoked 40 cigarettes a day, and she used my method. Within 2 weeks, she quit, and she's 6 years clean. Today, I had a 64-year-old female who smoked for 45 years. She had 1 counseling session with me. She practiced the breathing cigarette, and she's off it for 6 months. She no longer coughs, and she had this wonderful smile on her face. She said, "Oh, doctor, I feel so good. I don't go through those withdrawal effects and I'm saving so much money. You too can do it." I have a police detective who smoked for 20 odd years. He had panic attacks. He couldn't even drive. He was a heavy drinker. 1 counseling session with me. He's 40 years clean. Yes, he's had a heart attack. He's got diabetes. He was about to go to England to celebrate his 70th birthday feeling hale and hearty. I can guarantee you, if he didn't stop his smoking and drinking, he would have been in his grave 10 years ago with his diabetes and heart attack. I hope I've given you enough food for thought. And now I would like to conclude with a few statements, my quotations. Again, number 1, I empathize with all the smokers. I think you've been done in badly. Not because I like smoking or I promote it. I understand addiction, and you got one of the worst addictions, and nobody came to your assistance. Number 2, I believe you do not treat addiction through punitive measures. That's archaic and barbaric. You treat an addiction or an addict, you treat them with compassion, with love, education, patience and understanding. Doctors in the past, I remember when I was under professors, they would shout at patients. You don't beat them. You don't make them shy. You shouldn't make them feel guilty. They're not criminals. They have a disease. Thirdly, I think the government needs to listen to this one. I hope they're watching. Please tell them the power of addiction is so great that no amount of repression will prevent an addict from getting his or her fix. And I think you all know that. Addicts have killed parents for their money. We know about the young man in Stellenbosch who killed his entire family. So with that in mind, to my ladies and gentlemen who've been watching this program, I urge you to make an attempt to stop smoking so you can live longer and healthier lives. You won't damage your lungs and the lungs of your children. Remember, every time you smoke, you're puffing that smoke into your children. You won't be denying your family of essentials like is being done at the moment, where people are buying cigarettes and queuing up for food, using money for electricity and food just to feed their habit. You won't leave them destitute when you die at the age of 40 and a young child of 6 doesn't have a daddy or mommy to come home to. You will be pleased to know you'll have more money in the bank account. Why? You won't be buying cigarettes. And lastly, you'll make me poor because you'll be making less visits to me. As much as I don't like that, but that's the reality. Well, I hope you've enjoyed this little presentation. I tickled your sensation, educated you, stimulated you to make a change in your life. And stay healthy. And remember, buy yourself a Daily Voice, the newspaper that brings you all the news that mainstream people don't bring. So I wish you well in your endeavor to give up smoking. Anybody that wants to learn about my program or want to get a copy of my book can contact me. My telephone cell number is 082 5811 846. My email address is robertrapiti@gmail.com. You can connect with me on Facebook at Robert.Rapiti. I look forward to your comments. Yes, I know I'll get some nasty ones. Please, I've got a weak heart. Don't take your venom on me. I think you should ask the NCC why they did this to you. I wish you a very pleasant week and months ahead, and I do hope many of you will quit. God bless.